Assalamu alaikum, the communication day. First scenario, you are the medical registrar in the neurology ward. Mr. Robertson, 85 years old and diagnosed with motor neuron disease. His son wants to speak to you about the further diagnosis. He has bulbar symptoms but refused the big tube insertion. The task to speak to Mr. Henry, address the risk of aspiration and address the risk concern. Yeah, here you go.
Okay. Hello.
Hi, hello.
Um, I am Dr. Ahmed. I'm doctor in the clinic today. Uh, can I confirm your name and age, please?
Uh, Hi, I'm Mr. Henry.
Okay, nice to meet you, Mr. Harry.
Nice to meet you.
Okay, today we are here to discuss some issue related to your father condition
Yeah,
and
actually,
address your
doc.
concern.
Doctor, I've heard that my father has a diagnosis of MND. I went yesterday to read everything about it online, but I was fed up. I thought to speak to the specialist about it. So what's that? What does that mean, doctor? I've seen so many things I couldn't grasp any of it, to be honest.
Okay. Um, uh, Before we start, are you next of kin of him?
Yeah.
Okay.
I'm his
I think
son.
your
Yeah,
father. Okay.
yeah.
Okay, nice. I think your father doesn't mind to talk about
Yeah, of
his
course,
condition
yeah.
with you.
Yeah, of course, yeah.
Okay, okay. You have idea what father have?
Yes,
You
doctor.
have you have idea about the
Ye-
condition of your father, motor
yeah,
neuron disease, or
I went to look it up online, to be honest, but I there was so many information, so I thought to speak to you, to one of the doctors about it. You are the specialist. Yeah.
okay, good,
Mm.
good. Okay. You understand the condition, so no need to explain to
No,
you about motor neuron disease. We will talk only about
no. I read about it, but I couldn't grasp any of it, Dr. Ahmed. From
okay.
there was too much information online, so I thought to speak with you about it to just explain it to me. Yeah.
Sure. Okay. This is a group of disease that
Mm.
affect muscle and
Hmm.
affect the nerve cable.
Okay. Oh, yeah.
Okay. Yes, this is they will be destroyed to the neuron that make movement of muscle. So when
Hmm.
this is affected, muscle will be difficult to move.
Okay.
So can affect all muscle, even
Hmm.
muscle of talking, muscle of swallowing,
Hmm.
even muscle of breathing. Yes,
Oh, so this
muscle
is
all
why
over.
yeah, so this is why he's not swallowing very well. Yeah. Okay.
Yes, this is condition affect all muscle in the body and can cause weakness.
Okay. Okay.
Okay,
So
okay.
what's the options, or what do you think that's this condition? Is it progressive? Is it going to be treated? Um,
Um, I highly appreciate your concern. This condition is long-standing problem. It is also uh, progressive problem and
mm,
also has no good prognosis for the condition. Uh, so
mhm.
need more care uh, and need more care and more support. But this is not curable disease.
Okay. Okay.
Yes,
Okay. Mm. So is
for
there
now.
anything that we can do to improve the things around him, like um, what we are going to do regarding that? What's the step forward?
Uh, uh, Treatment available now, only supportive treatment.
Mm.
As now, your father's our team is decided to do for him what is called a big tube. Don't bother by his name because has a problem, cannot take oral food, so need to give food directly to stomach.
Okay.
So decide to give him to do for him a big tube according to the best interest of his condition now. You know big tube, or you want me to explain for you more?
Um, no, so it's a tube that would help delivering the. Just 1 second. So it is a tube. What I do understand, it's a tube to help deliver the food to his stomach, as you've explained. Okay. Um,
Okay.
does that will be a long-standing thing then? So
Yes, I highly
yeah.
appreciate your concern. I highly appreciate your knowledge. Thank you for sharing me this information. As you mentioned that big tube provide nutrition, fluid, and even medicine directly to stomach
Okay.
via this tube through the tummy wall, through the tummy, through skin tummy. And this is done when facing difficulty in swallowing,
Mm-hmm.
as your father condition now. Okay.
Okay.
Uh, so we need to do this tube as the best interest of his condition, as the team decides that.
Mm-hmm.
Is it
Okay.
okay?
Uh, I guess if you see so, yeah.
Hello.
Yeah. Can you hear me? Can you hear me, Dr.
Ye-
Ahmed?
yes,
Yeah.
yes. Uh,
If the
is
team
it okay
thinks,
to proceed
yeah,
for
if
this?
the team thinks so, it's okay. It's fine. Yeah. I don't mind if it would make him feel better.
I appreciate your understanding. Thank you. So I want to ask some social question.
Okay.
Um, what your father doing?
He's an 85, so he enjoys sitting at home.
Yes, okay, sorry, it is
Yeah.
retire. Okay, 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 okay. Do you smoke? Do your father smoke?
Mm, not to my
Mm.
knowledge, no.
Okay. Um, okay, is financially supported? Who is support your father?
Yeah, he's financially supported, yeah. Yeah.
Yes, financially supported, and I mean support in all part of life.
Yeah.
Okay, good. You are supporting him?
No, I don't live with him, to be honest.
2 minutes
Okay,
Yeah.
left.
okay, okay. Okay, okay, we can contact even if no one support him, we can contact social worker and
Mm,
even a nurse, and even there is a special team, home nurse also is can be care of your father.
okay. So how we are going to manage his feed um after we sending him home? How we are going to feed him?
Through this tube, by big tube,
Yeah,
but
but he
until
lives with
until your
mom.
father
Mom, I
condition
think.
being still. Ah, okay,
Yeah,
okay,
he lives with my mom, but I think my mom would. I don't know if she would be able to handle this, but
good, good, good job. Yes, good job from your mom. We appreciate that. Uh, that will be nice.
yes, but I'm not sure that she will be able to handle this. Is there any sort of help that she will get or any form of training on that? Because it's something
Yes,
we've never
sure,
dealt before.
sure. Yes, sure. Before discharge from hospital, after being stable, we will learn everything, how to
Okay.
use, how to give. Yes,
Mm-hmm.
yes. Do you have
So
any concern? Tell me.
what will happen if this tube is not inserted, or if he doesn't have this tube, doctor?
Uh, like this situation will be serious because now your father cannot take anything orally, so will deteriorate it, and already the condition is very serious, and I am sorry to tell you this condition is has a high rate of death. So if we not
Mm.
proceed, maybe this will be more quickly to
Thank you.
deteriorate and will be a very bad
Yeah.
situation.
Thank you, doctor. Time's
Okay,
up.
time is up. Yes, you can comment now based on the skills, Dr. Amr.
I will give you some brochure leaflet to read more about big tube and
Thank you.
complication. Thank you.
Uh, Dr. Salma, I'm not sure if you were busy, or have you read the scenario?
Yes,
So what you understood from the scenario? Maybe it's my mistake in phrasing the words, but
I understand that. Um, uh, Mr. Robertson, 85 years. This is diagnosed with motor neuron disease and refused to do big tube.
so who refused? The patient. So
Mm. But
this
in this
is
situation, I have no
and the
idea about
task.
the capacity of father.
No, 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 no. So have you checked the capacity of his father? Motor neuron disease
No,
doesn't affect the capacity in general. Second of all, you've done so well. No, don't take my words as it is, attacking you, please.
no
But
problem. It's okay.
it's just, for me, before even anyone. Sometimes they this how this station was phrased in my exam. Okay.
Yes,
Uh,
me also good. This is good scenario for me because always when there is like this scenario, I am confusing because
no.
I'm
So
not
the
talking
task.
directly to father and I have no idea about capacity. And
So okay.
who
So
I will ask son about capacity. Then why
so
I
that's
didn't talk directly with
one.
the father?
So one
So
second. So the
yes, tell
the
me.
the task is to address the risk of aspiration. So as I started with you, the surrogate was starting with me that he have explored about the MND. You didn't uh, get it in the first place when I told you that I've already checked online, but I found the information is overwhelming, and I found so many things. But so I wanted to speak to you about it to simplify things for me. So you assume that I knew about the diagnosis, and then I've rectified you. But the main task is to address the risk of aspiration because the father has refused. Okay, so his father has refused. Whenever you are speaking to a relative, you've done so well by checking the consent. But there is 3C: consent, capacity, and coping. The capacity: have you been to your father's bedside today? How is he doing? He will tell you it's fine. He spoke with me. So if there is nothing written or raised from the surrogate or from the stem that the patient has capacity, you don't assume against that, especially if the disease doesn't affect the mental status. Okay, this is in response to your question about the capacity. Okay, so you can touch base with the capacity if you are not sure by asking, have you seen your father yet? He would say yes. Okay, how's his is he in capacity? But you can touch base with that by telling him simply, what was planned for him is to have a peg, but unfortunately he refused. He might tell you, okay, he's stressed, he's not thinking properly. Okay, why do you think he's not thinking properly? He will be telling you, okay, he might tell you that he's not having capacity, or then you can offer capacity assessment. But there was no capacity issue in this gentleman. He's compos mentis, he has autonomy, he has refused that. Now we are needing to discuss the risks of not having the tube.
Okay, but I want to add to your point, Dr. Omar.
Mhm.
Motor neuron disease can affect the behavior and the capacity up to 50%. Okay, I just researched about it.
Yeah,
It couldn't be there, but it could be also affected. So, uh,
but it wasn't raised. But
yeah,
if
in,
Dr.
in this
Ahmed, if Dr.
scenario,
Salma
yes.
is correct. Yeah, I'm sorry, Dr. Bassem, you can comment. Yeah.
Yeah, I mean, in your scenario today, it wasn't affected, but sometimes it could be affected.
Yeah, so
Okay.
Dr. Salma was correct by suspecting the capacity, but she didn't address it. Uh, like you have to find your way of touching on on the capacity. Keep in mind when you are speaking to relative, you have to assess the C's: capacity, consent, capacity, concern, and coping. Concern is by nature within the scenario, but coping. Some scenarios you are talking to a relative, how you are coping with if he lives with him, okay, how you are coping with your father's with your mom, with your father's care. He will tell you that, oh, I'm going to work and don't have any time for, so you play the card of social team and carers and stuff. So keep this into your mind. You ask about the consent in the very beginning, which you've done so well. And if you have any concern about the capacity at the very beginning, you can establish it. Or if the surrogate is proposing that there is capacity issue, if it's not said in paces, we don't assume. Okay?
Excuse me, how I can ask this one? I ask him, I tell him, what about capacity of your father?
No, you can ask, have
What?
you been into your father's bedside today? He would say yes. Okay. How do you find that he's if it's not written to you that his father is confused or there is confusion or anything, then you can how did you find the conversation with your father? He will tell you, yeah, it's fine. Okay, so you have no capacity concern about your father. He will tell, no. Is that helpful?
Mhm.
This is my way.
This
I don't know.
situation, in this situation, no capacity. I will continue with son. Even I will ask what I will tell about. Maybe
So let's
are
stick
you
with
willing
this.
to do? Hmm?
Yeah, let's stick with this scenario first because the scenario, the patient does have capacity. He refused. What's your task is to speak with the son about the risk of aspiration. This is the sequence of event.
Mm, mm,
Okay, but
mm.
in other scenario, similar scenario, the patient is confused. Okay, or he doesn't have capacity. You are taking the consent from the father, from the son.
If father has a full capacity, then I
If
will do conversation with father and I took consent from father.
yes,
Always,
Even
always the
even
consent,
if refused.
Dr.
even
Salma,
if refused. Okay.
always the consent will be from the patient himself. To sit with the son, either to talk with him, just to inform him, but the main signature will be from the patient himself, the father, the mother, unless he lost the capacity. If he lost the
Mm,
capacity, it will be by the team as a committee consent. But after also talking to the son or next of kin. I hope it's clear.
So right now, if you've went to that direction and told me that your father has refused, my my question to you is that would be, okay, can I sign for him? You would say no. Can I sign on his behalf? You would say no. Okay, this is ideas for different scenarios. Similar, same scenario, but different concerns in different centers, whatever. Okay, so you would say explicitly no if the father, before saying yes or no, establish the capacity. Have you been into your bedside, to your father's bedside? Does he mentally sound to you? He would say yes. Okay, so then he has autonomy. We can't override his decision. Okay, so in this scenario, if the father continues to refuse, re, re we will discuss that with him again. And if the son is concerned, you can offer the best interest meeting toward the end. But this hasn't been discussed because you went into a different direction in the conversation, and you assume that um, the pig is going to be inserted, and you are discussing a thing that it wasn't in the task. So, what was what do you think that, or what was in your mind at that time when you are reading the scenario? So, to the confusion that you had when you read the scenario, Dr.
Yeah,
Salma.
I think Dr. Selma didn't get or pay attention to the refusal. So she's talking about the acceptance from the son. I want to ask you, Dr. Omar, did you receive the
Mhm.
feedback about this scenario?
Not yet, but it was
Yeah.
passed. But
Fast?
I've passed it. Yeah, I passed it. Yeah.
Yeah, I know. Any marks minus in this scenario?
No, no.
So the way you are talking, like it's the perfect one and the correct way to address the refusal of the father with the son, right?
Hmm.
Isn't? So I
Yeah.
am talking to the son like,
Telling him that your
yeah,
father
the
has
father is
refused.
refusing it, yeah, and the risk of
Uh,
aspiration.
it is in a form of updating the relative. Like, you
Exactly.
know, that there is an update. I'm giving him an update. Of course, the scenario was very lengthy.
Hmm.
So, but I've tried to summarize the important things because last time it took it took two messages to fit the scenario. But this was the scenario that
Perfect. Okay. So let's judge on Dr. Salma performance based on your skills and your mark. Did she do the clinical communication skill perfect or borderline or unsatisfactory? So satisfactory, borderline, unsatisfactory. Yes,
uh,
we started this yesterday. Those
okay.
who's coming having coming exam or near exam, we want to do the skills marking based on the performance. So
Mhm.
can you start now the judgment based on your
So
performance in the exam? Yeah, the first
cl
one, clinical communication.
clinical
What did you do?
communication.
Yeah,
Um,
it's okay.
uh,
Honestly,
it was
no matter.
unsatisfactory. Yeah.
Yeah, unsatisfactory. I agree, by the way, because
Mhm.
she spoke about something which is not related to the case. It's okay. We
Mm,
are judging as a real one because she has to correct it. So the
mhm.
clinical communication will be unsatisfactory. The next clinical judgment.
Satisfactory. Yeah.
Okay, and the concerns.
I wouldn't consider the concerns. It was managed, but there is two concerns if she went to the refusal will be addressed, but it's satisfactory. The welfare is maintained.
So all are satisfactory except the. So it will be 12 out of 16, right?
Yeah.
Okay. How to correct? I think the consent here is not to be obtained, Dr. Salma. You cannot obtain consent from this, even the next of kin. You are informing him. But this is not the matter. The matter is to talk to him about the father refusal. So you have to find a solution for that. Okay? Unless the father is lost the capacity, you cannot do it so. But if the father refusal based on the capacity or assuming that he has the capacity, so you have to talk to the next of kin that your father refused it and we want to have a solution for it. Okay? Why it's important? We have to explain why it's important because it can prevent further aspiration. Don't say aspiration. You can say the food particle is going or are going to the air
Windpipe.
pipe,
Yeah.
perfect, or windpipe, and it can lead to some infection, and with the time it might also make the lung scarred, and it could reach to level of failure. which can threat his life. That's why we are here to sit with you to inform you about this and that. Okay? This is the
Okay.
first point. If you can draw, it will be great. Okay, for him, you are explaining not to again, not obtaining consent, why it's important, and what the motor neuron disease. You try to explain it, but I think you couldn't explain it in proper way. So I think it's the way of saying the motor neuron disease is a known disease, which sometimes run in family and other is not non-expected, or you don't know why it happened apart from the familiar one. So we don't know. Sometimes the muscle is not understanding the message from the nerve. That's why he has this weakness, and even this weakness can affect the muscle of breathing, and sometimes the swallowing.
Yeah, and
That's
and
why.
and yeah,
Yeah,
Dr. Salma has said it in a very good way that it will affect the swallowing, so and the muscles of the neck. But
perfect.
what came into my mind in the exam, to be honest, is that I told the surrogate that the nerve and the muscle are not talking to each others anymore.
Perfect. It's good, also simple and nice,
That's
but
it.
nice definition. Yeah, it's nice one. So the
That's it.
muscle and nerves are not listening to each
So
other.
the muscles are starting to sometimes contract on its own. So this
Exactly.
is why your father had difficulty in swallowing. That's
Yeah,
it.
perfect. Yeah,
The other,
and then
yeah,
on
I'm
a
sorry.
breaking bad news way, Dr. Omar and Dr. Salma. So it's breaking bad news disease. It's a
Yes,
progressive one. It works
yes,
day after day. I'm so sorry to say that your father might end up with ventilator or the machine which can help him to breathe.
yeah,
Right? Yeah.
yeah. One, two, or two advices to help Dr. Salma
Okay.
is to use different words when you are appreciating the patient concern to refrain yourself from sounding robotic.
Okay.
If the patient is saying, if the surrogate is saying, let's for example, oh, I want to know how long my father is going to live. Well, it's a very valid question. Thank you for raising this. He told you that I came to speak to the specialist. This is a correct thing you've done by speaking to us today. I'm here to help. Uh, Try to find two or three phrases that works for you, that is from your personality, reflects your personality, your actual personality. This is what you are saying to the patient every day. But if you kept repeating, oh, this is a very valid concern, I do understand where it came from every time, it will sound robotic. This is my
Yeah, it's good advice.
advice.
Try to have different phrases, and don't say, if he mention information, you can say yes, I appreciate your knowledge, but don't whenever he's worried, and you will answer like, I appreciate your information or knowledge. He's worried. He's saying to you, I'm worried. My father might die, and you are saying for him, yeah, thank you for sharing this information with me. I appreciate your knowledge. He's worried, so you can say, I can see how much, or I can imagine how much you are worried about your father. I mean, make the answer always
Mhm.
related to the question, not away from it. The last point: does he smoke? Does he drink alcohol? What the
It's not
matter now?
necessary.
It's not at all. No need to
No.
mention it. If you want to ask about something might be related, could be the driving, because the weakness might affect his driving if he is doing so.
He
Okay?
he he can't drink, so how he would be drinking
Whatever. Yeah, we
alcohol?
don't yeah,
Yeah.
because it's
Mm.
something in his wishes, and it will not affect his outcome. The last thing, the last thing I want to ask, maybe you can talk to him about advanced directive, but in good way.
Yes.
Yeah,
Yes.
may you, whenever you
This
are
is very
sitting,
good. Yeah, Dr.
yeah,
Bassem. Yeah. This is
whenever
very
you are
good.
sitting with your father, try to talk about the further in
No,
future.
does he have, yeah, does he have any future plan? He will tell
Yeah,
you like what? In terms of if he's getting very unwell, does he express any specific views about this with you? He will tell, oh yeah, I've never asked him, so okay, thank you, that's it. So by this, you are ticking the boxes to the examiner not to the surrogate. If the surrogate didn't give any information to you about this, don't push him because he's not been fed about this. He might not be been informed about this, especially in the overseas center, because they don't have this information in their culture.
Yeah.
Unlike UK, so they have a better understanding on the end of
Yes.
life or advanced directive.
Advanced directive. Yes.
But in overseas, the surrogate will have limited knowledge into this. Whatever has been in his hard drive, he will say.
Yeah,
Okay.
yeah, you're right. So
Yeah.
but it's again accepted if you can speak about it in brief.
Yeah.
Anything your father wishes or related to his management, he would like to be managed through, please let us know. Okay, in this way. Otherwise, as you see in the chat box, this is your skill marking. By the way, I am sharing the skill marking in the Facebook group in the comments. Any participant want to know the skills marking, he can see it in the chat box in the comment. Sorry, in the comment in the Facebook group. So everyone will know which skill he want to improve, which skill he's good, and which one need to, as I said, need to be improved.
Dr.
Uh,
Basim,
yes, Dr. Salma, any question?
sorry, yes, I want to point again this point of capacity again.
Yeah,
Uh,
Okay.
because really this point is confusing me. If father is have a capacity, then I will tell him I will arrange another meeting with your father to discuss with
yes,
him.
and to obtain the consent.
Uh,
And
Uh,
Yes.
he will sign the consent if he has the
he will
capacity,
sign it.
and
Okay.
if he's agreed, and if he's agreed, sorry,
Okay.
and if he's
Okay.
agreed. If not,
And if
you will.
have no capacity,
So you cannot tell him I will have consent from you, or I cannot take consent from anyone. He is the only one assigned to sign this consent form, the patient himself. I'm just
as a
informing
situation,
you.
mm,
We are informing you that we have made a decision to do this procedure. So it's a
okay,
medical
according to
decision.
the medical decision team.
Exactly.
Mhm.
Yes, it will be a
Okay.
consent form 4.
Yeah, it will be signed by the team. And as you said, in the best interest, always mentioned in the best interest, okay?
Mm.
Yeah.
Okay.
Okay, let's go to the next scenario, Dr. Omar. Your scenario, Mrs. Samia, 27 years old, complaining of tummy pain, loss motion for last 3 months after investigation, upper endoscopy done, diagnosed with celiac disease. Explain the result. Okay, so we can give you Dr. Omar sometimes. I will read the
Dr.
comments.
Bassem, can I just add few points?
Yes, Dr. Hind, of course.
Just I want to advise you about something like if you fixed a way to deal with the capacity, it will help you. You people forget that you need to take a permission before you start talking to the next of kin. So always remember that I need to say the sentence, we have already discussed with your dad and obtained permission to proceed with this meeting, right? So you cannot say this word if you have a clear sentence in your scenario where it is mentioned there is a capacity, so you can proceed with this sentence. But if there is no clear sentence to guide you, then you have really to say the same question which raised by Dr. Umar, that did you have any discussion with your dad? How is your dad is doing? Did you pass through him? Any discussion went between both of you? How much did he tell you about his condition? Okay, so this way you integrated the question about the capacity as a part of your scheme. And after that, after you obtain the information from the relative, you are confident to say that we have obtained a permission from your dad to run this conversation. So if you keep the habit of mentioning the sentence of the permission, you will never forget to check capacity. And we have to, whenever we talk to a relative, we have to confirm whether he is a carer or next of kin, and we have to raise the point of the permission. We have already talked to your dad and obtained permission from him. And since there's no clear information about capacity, so you have to obtain that information before talking about the permission. So this way you will not forget. And I like the C's, the rule of C's that mentioned by Dr. Omar. Only he missed one C. Always make sure that the diagnosis you are talking about is a confirmed diagnosis. So you have to think of two C's, which is fixed in all the scenario. If there is a diagnosis, if it is a suspicion or confirmed, and if there is a capacity, whether you are talking to the patient himself or relative, and whether your patient have a capacity or not, because the way you will deal with the scenario is different, along with the coping mechanism and the consent, if there is any procedures. I totally agree with the remaining points, and it is really nice to keep those C's in your mind. Then I would like to raise something which you people have discussed the whole scenario, but you forget the clinical judgment here. What is the definition? This is a question for Dr. Omar. What are the items which should be done by Dr. Selma in order to get a full mark in clinical judgment from your point of view? What boxes should she need to tick? Or at least
The
to give her
management.
satisfactory. So what
Yeah.
points she have discussed with you that made you give her satisfactory? At least 3-4
The
points.
understanding of the disease. She showed good understanding of the disease and
Okay.
the prognosis.
Mhm.
She touched base with the management. It's not in the clinical scenario, in the communication scenarios. The deep knowledge understanding will not be addressed as harsh as the
I
long
agree. We need
consultation.
general highlights.
So this
Yes.
she met what is needed in the communication scenario. She understands the concept of the general concept of the disease.
Mhm.
She knows that the big tube is needed for that. But her judgment overall, what you are looking for, Dr. Hind?
Actually, I'm looking for the aspiration precaution.
So she missed completely the aspiration. So
Uh,
the aspiration risk. Yes.
so clinical judgment always depend on something. If she have to get benefit from your scenario, you have communication is something we acquire from repetition. As much as I repeat, as much as my communication will become better. Sometimes even this process is passive. No need for someone to improve my communication. Hearing, repetition, I will get. But believe me, clinical judgment is something not passive. It's active. You have by yourself to give her the checklist, which she need. You give her satisfactory. This is a big deceiving mark from your side. She think now that she did very well in the management. Actually, I didn't hear SALT team. I didn't hear dietitian. I didn't hear aspiration
Yes,
precautions.
but this is not the consultate like what I'm trying to say. This is not like the station where you discuss the full line of management. The patient, this is
You are not.
a momentarily discussion. It's just an
Mhm.
update. He asked what we will be doing next. In her
Yes,
line of
that's why
thoughts, in her line of thoughts, in her
Mhm.
line of thoughts, Dr. Hind, she was thinking as if she completely missed the task of the
You
scenario.
ask her a very nice concern where she had the chance to address it very well. You ask her directly, what if my dad did not fix the big tube? Here, she took at least, I was looking at the time, 1 minute and a half, and
Mhm.
she was too much like into nothing to be done. He will aspirate, he will not be able to eat. So
Yes, and this is okay.
this is not true, because you will do your best as a team to make this less risky for him. For example, let's say he
Mm,
refused the big
no,
tube.
if he refused the big tube, he will
There
sign
will
on
be
the
risk of aspiration, but
he
now you
he will
have to
have the sign.
explain
Yes,
the effort of the team to minimize this risk, right?
yes. What it will be?
What it will be. First, the dietitian will give a semi-solid food.
Y-
So it will be less risk for aspiration. The
Yes.
patient, we will make sure that he's 45 degree. Okay, I agree with you. You don't want to go through, even though from my point of view, from the practice and the mock exams which I attend, they love to see that you are giving a general outlines which is correct rather than referring. They don't like, I will refer to SOL team, I will refer to dietitian, they will take care of your dad. I have to give some precautions, some outlines. So there will be, we will not leave your dad, even if he refused the big tube, even though it was the best modality to minimize the risk of leakage and save his lungs. But we have another alternative management plan to help him as much as possible and to minimize this risk and to give him the best chance to eat
Mm-hmm.
safely through the speech and swallowing team who will follow up him and the dietitian who will give us advices about the best formulas which minimize the risk of aspiration. We will teach you some precautions which if you take care of, you will also help your dad to minimize the risk of aspiration each time he receives food. Okay? And
Yeah.
and there will be a nurse who will check on him regularly and will follow up with him. There are specialist nurses, whether in the community or now in the hospital. Don't go in detail. There will be a specialist nurse who will follow up with him and check on the technique regularly. And there will be a package of care. You told her, I need some help for my wife. For not my wife, for my mother, because she's taking care of my dad, and
Yes.
she didn't mention the package of care that there will be a social.
No, no, she asked for the social, but
Perfect.
for the
Okay.
package, but for the package, when I told her that my mom is might not be able to handle this in the very beginning, she touched base on that. So the main thing is that what you said, Dr. Hind, is very correct. I'm not arguing against that, to be honest. And what I said in the real station, it's in that way. But if this was in her line of thoughts, usually they will, yes, you've missed the task. They are going to fail the station if you've missed the main task in the communication, because it's not what you meant to discuss
But
anyway.
I think she had a chance to rectify this when you asked her what if he didn't insert the big tube, because this scenario at that time you helped her. You gave
Yes,
her the task, يعني by your concern, you pushed her to address the task unintentionally. So at that time, her answer should not be that he will not be able to eat.
he will not be able to eat. He will not be able to
He
eat.
will be able to eat, but with a high risk of
Of
aspiration.
yes. So from
Right?
what she said, what I've got from what she said, sometimes there is um
You are a doctor. She will talk to a surrogate. You have to change your way of perceiving her answers on a level of a surrogate, not on a level of a doctor. I
yes.
know that all of us, we understood that she didn't do something big. But if
Mhm.
you were a surrogate at the level of someone who is like who is a carer or who is not a doctor, and he heard the word that my dad will not be able to eat, what do you think his reaction will be? Am
He
I
will
right?
not be able to eat. Now,
She said
you are right.
clearly. She said clearly he will not be able to eat. I
because
said,
because difficult toward the end, if he's having difficulty to swallow, what's the next step that the MND patient does have?
I agree. I agree. But why you jumped since this patient was assigned for a big tube, this means there is still a hope
No,
that this patient, he is not end of life
no,
or like,
no,
yes,
he's not end of life.
end of life. I will not insert a big tube. I will give palliative treatment, what we call it, feeding at risk or soft feeding at risk. There are two terms for when we feed a patient in the end of life: just moisturing
For
the mouth,
confronting the
keeping the
patient.
hygiene, and feeding at rest. That if he wish to eat something, we will tell him about this and he will eat because it is like his last days.
But
But
he,
he's not at this stage
but
since there was a
if
big
he
tube
refused,
discussed
yeah,
with him,
yeah,
right?
it was
So
discussed. He refused. this is the next step would be accepting the risk of aspiration, and this is the task that you need to discuss the risk of aspiration that he has been discussed with, he's refused, and then if he refused, he will be eating
If
and
he
drinking.
continue to,
It
yes,
will,
if he continue to have those aspiration risks, he might reach a stage. I agree with you, but there is a stage which is still before the end.
yes, but his expectancy from that to then it won't last long. But anyway, Dr. Hind, it's what I'm not against what you are proposing. Your question to me was why I give her satisfactory on clinical judgment. This is what I thought.
No, no, this is
From yeah.
this was my question because I would like to know that what are the points you were looking for. But then I was happy that you mentioned about the prognosis, about the management plan. But from what she said, if I am a surrogate at the level of a patient who is at a level of a carer or like next of kin, I would love to see some effort. I would love to hear some teams who I will get in contact with, advices, precautions, some effort to be done to help my dad live with his refusal, but still live a decent life, some quality of life given to him based on whatever like options will be offered. Because refusal of PicTube is not the end of the story.
So Salt team would be one of the steps that you will take. They will offer solution. Yes, I don't disagree with that at all. If he
Right.
continue to refuse, but when I said that he wants to eat and drink everything, so this is when I started to tell, okay, now we are accepting the risk of aspiration.
Not
There will
you
be,
cannot.
I'm not denying the risk
Yeah.
at all. Bilaks, in this case, the daughter should understand that her dad is putting himself at a risk of aspiration. And we have to deal with it now, minimize it as much as possible. And this is what I think the whole scenario is about. How to
Yes,
minimize the risk of aspiration, but at the same time, give him like compensate for a good nutrition, continue feeding but minimizing the risk of aspiration, and at the same time if any complication happen, we will deal with it. If something
Dr. Hind.
happen, that's it,
Yeah.
we will give antibiotic, we will admit, and those stuff. I think this is need to be discussed even if briefly, but I don't know, saying he cannot eat,
Dr.
I
Hind.
felt it was like it made things complicated for
Okay,
me.
Dr. Hind, will we discuss about convincing the father if he has the capacity to sit
No.
with the father?
I
Because
No.
I think if the son was very angry that you should reconsider the decision, I will tell him. Usually, whenever someone is refusing, what I know from my point of view, that we keep discussing this option every
exactly,
time
yes.
we do the follow-up. So I will tell him that we will never give up on your dad. We will keep following up him, and every time we get a chance to reintroduce this and recheck your dad decision, we will do our best to again let him reconsider his decision.
Yeah,
So this is what I will say only. But at the end, and after saying this, at the end, we cannot force your dad to
exactly,
go
yes.
Yes.
against his will. And we have to respect always his decision and do our best in view of our patient decision.
One
As long
thing,
as
one
he
Keep
has the
supporting
capacity.
him.
yeah, one thing to add to Dr. Bassem's question, Dr. Hind.
Mhm.
If the scenario, not in this scenario, if the scenario was a concerned son who is disagreeing with his dad wishes,
Mhm.
and he's not convinced with what you are proposing to him, toward the end you can propose the best interest meeting. In this situation, especially in elderly, you can just arrange a meeting, you consult a
As
nurse
long
in
as he
charge.
is refusing, I agree. You
Yes,
need to
yeah, yeah.
satisfy him. And even if
No, no,
he was not happy, you will end up by the
I just
consultant step that I can arrange for you a meeting with my consultant. He might be in a better position to explain for you the whole situation and
yes,
make it more easy for you to accept your dad decision. So I agree with you. As long as there is a refusal from the relative, I will not confront. I will not tell
yes,
him, I'm sorry. we respect your dad's, and we will not
Wishes,
listen to
yes.
you. So you have to be too much diplomatic, and you have to keep him satisfied till the end, and keep him feel that your opinion is heard. We will hear your opinion, but we cannot apply. Yes,
Yeah,
we
just
cannot we cannot comply with your wishes as long as your dad is competent and he can decide for himself, but in a very diplomatic way. But I will keep involving him, and I will take his opinion seriously, arrange for him a best of interest meeting if the dad accept. Okay, because you have to
yeah.
make sure also that you will not you will not promise him something, and then the daddy will say, no, I don't want to make any meeting. It's a final decision.
No,
So make
can
sure
can
that
I
you say,
just make the point clear, Dr. Hind?
Mhm.
So in the scenario, if the son is concerned, actually the son can be attending the meeting, and the father, yes, of course, if the father is happy. But what I'm proposing to Dr. Basim's question is, in addition, if the best interest meeting fails to establish the situation, this is not the end. He can revise, the decision can be revised during the follow-ups at any point.
Yes,
If your father has changed his mind, it's
at any
fine.
time we're ready. We are ready
Yeah,
to help.
this is
Yes,
not,
agree.
yeah. Okay.
I
Okay,
So,
thank
totally agree with you. And this have to be addressed in order to make him agree with his dad that there is a chance in the future when your dad will, for example, sometimes when there will be repeated admissions, maybe the dad will give up and say, "Khalas, okay, let's go for the big tube." So at every time there will be a chance to reintroduce the intervention to the dad and help him to reconsider his decision.
and
Every
always
follow-up.
the community team would ask for the best interest meeting before discharging in such scenario, not this scenario, in such scenario of disagreement between the next of kin or the family and the medical team with the patient wishes. Always the medical team will back up the patient wishes because we act on the best interest of the patient. And the family would be always wishing something that might be different from the patient views.
Mhm.
Usually the best interest meeting is there to sort out this dispute, and this is a very common dispute in
Medical practice.
within medical practice. And the best interest meeting is being done. It will be attended by physio, speech and language, nurse in charge, or the matron of the ward, usually the head nurse of the ward, and the consultant himself, or the consultant might ask a registrar to represent the medical team in this kind of meetings,
Yes.
because it's basically they want to discharge the patient, but there's something that is hanging the discharge in a point. They want the bed. This is basically why the best interest meeting is being hanged. Okay, we are doing this, we are accepting that you can revise they will
Decision.
the decision later on. They will need to attach this meeting to the patient's discharge paper for the GP to know, and then for the community team, either SALT team in the community or the carers in the community, so they are aware of what's happened within the hospital.
And why
So
the patient was discharged without a big tube despite it's a proper
yeah,
decision.
yeah. So
Agree
it's
with
it's it's just it's just for a sick. So there is no shame, nothing wrong to offer a best interest meeting if the surrogate, toward the end, in such situation, if he's okay, why not? Why we are not trying? Can I speak to my father? Can I speak to him again? No, it's not advised that you can speak to push him. He might be overwhelmed with everything. Don't we can offer a meeting which is in a very controlled clinical setting.
environment.
Yeah.
No,
okay.
no, I'm very happy with the introduction of this word, best of interest meeting, because usually when we discuss, even me, and I should admit that we mentioned that we will arrange for you a meeting with your dad after taking his permission where we can discuss this again. But I'm happy that you gave it some like formality. You made it like you gave it a terminology which called best of interest meeting, and you explained that it will connect the hospital team with the community team with the
The
next of
views.
kin
Mm,
and present the dad opinion in front of all those people. So
yeah.
nobody later on will object why this happened, why it didn't
Yeah.
go like
Yes.
this. So the way you explain it, it's really even make it more clear for me. Usually we used to say just we will arrange a meeting where we will take a permission from your dad to be there and we will discuss the issue again. But the word best of interest meeting and the communities or the let's say the people or the committees which will participate, yani thanks to you that you introduced this idea to us, at least for
And
me.
why I'm introducing this, because my other communication scenario, the surrogate stopped being painful to me when I introduced the best of interest meeting.
Okay,
He
so he
was
was
calm.
waiting this step.
He was waiting. I will save this to the next communication, but he was waiting till and then he rose another concern. Once I spoke the best interest meeting. As soon as I spoke it, it was in the last minute, he rose the last concern.
Okay,
Okay.
good discussion. Really, it's beneficial and helpful. I want to ask you, Dr. Hind, because you mentioned C's or
Four
something like
C's,
that.
yeah. Four C's. Consent, capacity, yeah. Dr. Hind.
Okay, the consent and capacity and
And you mentioned coping mechanism
Coping,
of the family.
confidentiality.
That's why it's very important in this scenario to say if anyone is dependent on the dad.
Yeah, this is what
Yes.
about to comment
Yes,
for Dr. Salma,
yes.
not to ask what his job, Dr. Salma. He's 85
It's
years.
making more sense to ask about the social
Yeah,
consequences.
exactly. Who's supporting him, not to ask what's his job. And again, the smoking you cannot ask, and who's supporting, as we said,
Yeah.
and who's taking care of him. Does he need any support? The one who's taking care of him, not the patient himself. Okay.
Like, for example, if we have a little daughter who she is still in the college
Exactly.
and
Yeah.
he's paying for
Yes.
her, now he will not be able to do anything. So
Perfect.
you will offer help to the daughter.
Exactly.
Okay,
Yes.
so this is
Yes.
the aim of the question. So if he said yes, he have a little daughter or his wife is dependent on him, okay, then the social worker, as a part of offering the package of care for the patient himself, there will be
And
also they will
the
take
carer.
care of the
Carer.
person who is dependent on your dad, and this will be discussed later on. So don't go in detail, but at least reassure that the package of care will cover the patient and his family or the person who's dependent on him.
Yeah. Good question also from Dr. Ashima. I want to know, to ask, do I can, or can I say to the son, you can discuss with your father that I told about the big tube importance. Maybe this can convince him. I answered you, Dr. Shayma. So you can just talk with him that we will try again to discuss, as Dr. Hind mentioned also, that we will sit with him again, but you can know from him what is in his father idea or what is in his father mind, why he's refusing it, and you can speak about the importance of it.
But the most important, don't encourage the idea
Yeah,
of the son going
to go
by
with him.
himself, talking to
Exactly.
the dad alone.
Mhm.
Always encourage the idea, as Dr. Omar mentioned,
In a meeting.
in a controlled environment. It must be an well arranged meeting in a presence of the team, so the son will not impose his ideas on his dad. Otherwise, the whole medical, it will be deceiving. It will be a false as if the dad was forced. Okay, so
Yeah,
never
yeah.
ever encourage. So if he said, I want to talk to my dad about this, just say, I would prefer that we arrange a meeting and make sure that experts are there. In the presence of those experts, we can reintroduce the idea to your dad. Okay, so it will be easier for us to obtain his real decision without any pressure, because we have to respect his decision since he have a full competency. And they don't like the word capacity. Use competency as a layman term. Okay, competency is the layman term of capacity. Capacity, some people consider it as a jargon.
Yeah, okay, perfect. Thank you, Dr. Hind. Dr. Omar, if you're ready, we can start the second scenario.
No, I didn't read the scenario yet.
I'm really sorry. I wish
No.
I made
No,
it
it's okay.
difficult for him to concentrate
It's
in his
okay.
scenario.
It's
No,
a scenario
fine.
about celiac disease counseling. Patient
Okay.
had loose motion for the last 3.
Okay.
But I just want to thank you really for sharing those scenarios which like you have experienced in your exam or the mock or whatsoever, because then you are introducing nice terms.
It's
So thank you so
fresh
much.
scenario, Dr. Hind. Just last year. Sorry, last month.
You mean
So
in the recent diet?
yeah, and
And
in the UK. So we can know how they are changing the scenarios, ideas.
I agree with you, the same idea, but different task. They never request such a task. It's
Yes,
always
see,
like
they add another task here, which is refusal of the big
picture,
Q.
as
Yeah,
if it's a step after the scenarios which we used to have. Like as if yani, now they are discussing a step ahead. Usually it's introducing the big procedure. Now
yeah.
they are
Now
telling you
they,
it
yeah,
has been
exactly.
done and the
Yeah.
dad has refused. Show me how you will deal with it.
So how to address it? Yes,
Mm.
exactly. Okay, Dr. Amar, we are waiting for you. Any time you are ready, we can start. Dr. Limar, very interesting discussion. Thank you. Yeah, thank you too also. Whenever you're ready, let me know.
Yeah. Just give me 30 seconds. Okay, let's begin.
Okay, here you go.
Hi, hello. My name is Omar. I'm one of the doctors here at the clinic. Are you Mrs. Sami? I'm talking with Mrs. Sami.
Yes,
Yeah.
yes.
Thanks, Mrs. Sami, for attending today's appointment. I assume that you are here to discuss the findings on your in your endoscopy result. Is that correct?
Yes, sure.
I'm sorry, I didn't get that.
Yes, yes. I came to
Yeah.
know the result.
Yeah. Okay. So, um, the results was showing that there is some changes in your bowel. It is caused by autoimmune, or basically your immune system is attacking the bowel lining.
Okay.
Can you follow me, Mr.
Yes,
Miss
yes.
Samia? Yeah. So we call this a celiac disease. Have you ever heard about it?
No, doctor. Can you explain for me?
So it is just basically the immune system is attacking your small bowel. We have large bowel and small bowel. Small bowel is the site of absorption of food and nutrition, and it causes inflammation to the bowel. Why is that? It's since hypersensitivity to one of the food content. Usually, it is gluten. Are you familiar with that?
Yes, yes. I noticed that when I am eating small pieces of pizza, I feel this
Yes.
symptom of tummy pain and loose motion is become more.
Yeah. So, knowing that this is the cause behind it, is it okay if I ask you about your symptoms? So, when you presented to us initially to arrange the camera test, since then till now, how's your symptoms going?
Same, doctor.
Same.
Even when I am eating something contain same like pizza or it
Mm-hmm.
increase.
Okay. This is so now you understand why this is happening. So I would like to ask you a few questions about your health in general.
Okay.
Um, do you have any skin changes, any rashes?
No, doctor.
No, not at all. Okay. And do you have any weather preference?
No, no, no,
No thirst
no.
sensation or going to the toilet more frequently?
Yes, I have loose motion.
Beside loose motion from, I'm talking about urinating more frequently.
No, 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 no,
No,
no,
not
no,
at
no,
all.
no.
Okay.
Only I
Um,
noticed that my weight is not
mhm.
like before, little bit
Dropping,
plus.
loss. How much? How much loss?
I didn't measure it, but
Measure
I
it.
noticed
Okay.
that from my clothes, from my ring.
Okay. Yeah. So, but you don't have any fever, any night sweats?
No, no,
No. Okay. Good. Do you have any family history of similar problems in the bowel?
no, no.
No, not at all. Okay. So, do you have any concern into your mind that you need me to you need to discuss with me today?
I want to know what I have.
Celiac disease, Miss Samia.
Okay,
So,
okay. Is it serious? What is it? Is it serious?
mm, well, it is a disease that is common. It does have some um, uh, can lead to some complications, but with manage with management, those complications are less likely to happen. Uh, it is not that serious at the moment, to be honest.
Okay. Doctor, you mean it's curable? I can be okay from this disease?
If you stopped eating gluten, taking it away from your from your daily food, symptoms will improve or should improve, and your diarrhea, everything will get improved. But there is no curative treatment for that.
Okay.
So whenever you eat again, anything contains gluten, you will start experiencing symptom. Do you get
Hmm.
it?
You mean I will continue like this for all my life?
Unfortunately, yes.
Oh. No, any medication can help me?
Particular medication, I'm not aware of, but for now, I'd like to talk with you about the steps that we are taking next. Are you interested to
Okay.
know
Yes, tell
them?
me. Yes.
So for now, we will be you will be managed within a team. Of course, the gastroenterologist have seen you and done the camera test. They will continue seeing you. You'll be followed up by one of the in the nurse clinic, and then you will be also seen by a dietitian to help putting a plan for the food choices, and they will can give you some advices regarding that.
Okay.
Also, we need to monitor your bloods every now and then for anemia. How is your the um, and other nutritional elements within your bloods to make sure that your absorption function is very well. One
Okay.
thing I want to uh, let you know that if by stopping the gluten, the symptoms is not improving, you should let us know.
Okay.
Do you have any family history? If you don't mind, Miss Samia, do you have any family history of any particular cancers in the family?
No, I didn't listen anyone have the same problem like me.
No cancers, no cancers runs within the family.
No, no, no.
Do you think you are able to not to rely on gluten within your food? Do you think it's accessible to you not to eat gluten-free diet?
Okay, it is difficult, but I will try.
Okay. It is available within the supermarkets that there is some choices of the gluten that is not gluten-free diet. But
Okay, that is good.
2 minutes
um,
left.
any particular question or concern into your mind?
No, no.
Okay.
Okay.
Toward the end, are you able to summarize what we have discussed today?
Nothing. Is this disease is running in a family? That's mean, يعني,
Mhm.
my kids maybe will got the disease.
This is a very valid concern. It does have an element of inheritance, or which means that it runs in some families, but if there is no family history from before, it could be it could you could be the only one who have it. But up until now, there is it's less likely that it will be your kids will be affected from it unless there is certain gene that has been inherited. Uh, but for now, it's too early. Are you considering getting pregnant or planning for starting a family?
No, no. Within this year, no.
Okay, so we can refer you to the genetic counseling upon that time. But as far as I know, I would like to check on that particularly and get back to you if you are needed. We can refer you to the genetic counseling.
Okay, thank you, doctor.
Thank you. Thank you. I think time's up, Dr. Bassam.
Yeah, time is up. Sorry, I was writing a comment down. Okay, you can start now the comment based on the skills, Dr. Salma.
Um, okay, only I noticed only one thing. I'm not experienced to make like marks, but I noticed that they took history, and this is I think not allowed to took history. They
No,
asked
it is
me if
allowed.
you have a fever, you have weight loss like this. So this is only point I noticed. Other also not ask about social history. This is only 2 point. Otherwise, very good, excellent.
Yes, perfect. So let's talk about it in skill wise. The first one, the clinical communication. Since he's taking history, which is not allowed in the communication scenarios, so it can minus you, maybe
Uh,
borderline or unsatisfactory.
but
Okay, what you want to say?
what I took is not history. It's ruling out the associated things with celiac that you need to look for when you are giving a diagnosis of celiac.
Okay, as we say always, whenever you want to say that, you can do it as an instruction. Please, if you have fever, if you have loss of weight, let's know, we can help you, or according to the finding or the thing you want to ask about, but not as a question, okay? Because you ask clearly, do you have, which is not allowed. If you can see in the instruction of the skill of the task, sorry, or of the scenario, you can find that they are writing history are not allowed to be taken. Whatever you ask as a question related to the history or question related to the symptoms, it will consider as taking history. The other thing, the family history, you can again enumerate whenever you have family history of cancer. Please let us know. We can have it. We will deal with it because there is possibility to be having a cancer. And
But
another thing, yeah, you want to say something?
I don't know. I don't know that this is, but maybe it's something different regarding
I don't think it
the
will be
disease.
different from overseas and UK. It's all over. Okay, let me
I'm
finish the
not aware of
comment,
that.
and you
Yeah.
can say what you want to say. Okay. The other thing, when she asks you what I have, doctor, you just ask her, and I don't like the way you said, Miss
Hmm.
Samia, you have a celiac. It's not really. It can affect the welfare. Why you are talking to a patient in this way? Like she didn't understand. You didn't hear Samia. I said celiac. It sounds like this for me. which is
Okay, okay.
affecting the welfare. So
Mm.
welfare will be, for me, unsatisfactory. For the clinical communication, since you take history, I will give unsatisfactory as well. The clinical judgment, what offer you give to her? Only gluten-free diet, right? And you didn't ask about the smoking, the alcohol. Sometimes it will affect her, which also can minus you in the clinical judgment.
The
Sorry,
smoking and the alcohol.
yeah,
Okay.
any disease as any disease. So you can talk about them. If she is doing so, you have to address it, right? This is the only thing you can ask as a social history. Okay, the last thing, the consent, she asked you about the family history, runs in family. I don't think there is not familiar or not genetic one, but it runs in a family, as I said, not in a familial or a genetic way.
Mhm.
The other question, yeah, you ask about thyroid. You have any other preferences?
Mhm.
What's the aim of this question?
It's the associations of celiac.
It's
Whenever you are giving celiac, you or discussing celiac, you need to make sure that there is no underlying under the association diabetes, thyroid, any skin
yeah, this is
rash.
whenever you have it in the long clinical consultation scenario, not as a communication.
Mm,
Communication to address how to manage, how to what to avoid, what to encourage for. Any complication might happen, but not
mhm.
for association. This is my comment, Dr. Omar. I
Yeah,
don't
that's
know.
fine. No, no, no,
Yeah,
it's
yeah,
fine.
yeah.
No,
I don't know even in
we are here
UK
to
if you do
learn, not
so.
to judge.
I know,
No,
but you are saying maybe it's different. I don't think in UK they can accept this. You have an exam recently.
yes,
Did
but
you do
when
so in your exam? Take
yeah,
history.
if my both communication, to be honest, that it doesn't have
Yeah, okay.
a very direct history, but I was asking, okay, how is he doing in general? Was his health before this admission? This is history. So how was his performance before this admission? He was telling me,
See,
okay, yeah.
Dr. Omar, functionality, what you are asking is called functionality and baseline health status. There are a complete scenario where the task is only address the patient functionality and the new baseline status. It is different than when you ask symptom-wise history. See, I agree with you that in past test videos, even when you attend the communication which is done there, the candidate is asking some history. But my advice to you, and I think also what Dr. Basim he want to tell you, some examiners, there is some agenda in their mind. They don't care if you ask a history, if you ask the red flags in a form of a question, or you enumerated them as a red flag for the patient and you told him in case you had any, please approach the ER. So he has different agenda. So he will not, he will not penalize you or cut your mark if you ask it in a form of a question or you ask it in a form of enumeration. But to be in the safe side and for the general form of the practice which we used to, that we better, if we can enumerate the symptoms, that usually celiac disease can lead to bloating, tummy distension, weight loss, can lead to change in the bowel habits, can lead to loss of some nutrient rather than being absorbed, it get lost in the stool. So the body will get affected because of losing those nutrition. So you are talking about malabsorption. So either you enumerate them and then you will tell that I think you had some of those symptoms when you got investigated, right? Yes, doctor, actually I had tummy bloating, I had. So you didn't ask a question. So this make it safer for people who are practicing because you don't know which examiner you will get. And then you will tell her at the end, in case you had any change in the nature of your loose motions, if there is any black stool or red stool, please approach us. If there is change in the rate of weight loss, like you are losing more weight than usual, if there is any new onset of symptoms like feeling sick, being sick, please approach us because you need to be investigated and we need to find if there is a new condition is raising. Okay, that's it. So see, I did all what you did, but I didn't ask any question. And when I'm defining the disease, I can tell that since this disease is a defense or disturbance in the defense mechanism of the body, there could be a new symptoms which might appear related to other diseases also caused by defense system disturbance, can affect some glands, can affect the skin, which we will keep you under follow-up for. So I touch the
Okay.
association and I touch the symptom and I touch the red flags without asking any question. So I took the mark of those, right? This is a safer approach for us, okay,
Yeah.
as overseas, because most of our examiner, they read this sentence, don't take history. So خلاص, functionality C, history allowed in station 4 for us is known. Functionality, social history, smoking, family tree. So if I have a genetic disease, I need to know how many siblings, how many offspring you have. So sometimes we need to ask some questions. Assessing risk factor for bloodborne, even those we try to enumerate rather than asking the patient, do you have any needle sharing? Do you do tattoos? We even, because we are scared that we get that examiner who said, oh my God, you took a history. So we enumerate them. So please, I agree with Dr. Bassem because we don't want any candidate attending the session to lose marks, but it might be accepted. Yes, it might be accepted. And one of the big examples where history is accepted, past test videos. But we want to be safe. We want to take the safe side. So
I,
don't,
I, this
yes,
is what
don't.
I noted in the recalls from overseas, and it's understandable, to be honest, why they are not allowing the history. It's because it's difficult for the surrogates to cope with the question lining because they don't
They don't
know.
have it in the transcript.
This is why. But
Mhm.
within the practice that we do, I'm not saying that that this is every candidate should take for granted.
Agree with
Uh,
you. And even in the
okay.
exam, sometimes they pass it smoothly. If you have
I've
like an examiners, as I told you, who are both UK
It's
and
very
they
biased
understood.
exam. Yes,
Hmm,
it's very subjective exam. I do agree. So the very good thing that you and Dr. Bassem has proposed is we can safety net against those things
hmm,
instead of discuss asking about them.
the questions.
Yeah,
Agree with
perfect. Yeah, this is good,
Okay.
a nice way to do. But I
So
want to
to
ask you,
yeah.
Dr. Omar,
Mm.
do you have this sentence in your exam in the scenario downward?
No, no, never. Even though in the recalls, not the recalls, but in the in some other colleagues who just gave the exam in different centers, they don't write this, don't take history at all. But it's understandable in overseas candidate because it's scripted. It will be scripted or a transcript. It's been written and
You know
designed by the
how it
Royal
was
College.
written? It's written, history taking is not allowed in this way. It's clear and it's a very clear sentence down. I don't know.
Yeah,
I'm
Yes,
really
Dr.
yeah,
wondering.
yeah, yeah. In
Bassem,
the
see,
overseas,
I
why?
agree with Dr. Omar because he gave you now some examples where we ask history. Actually, this sentence is confusing and it don't make sense because when we ask about functionality, when we ask about social, but we had this trend, what we called allowed history question, and history questions is not allowed. You get me? So by this, we find for us a way to deal with this sentence.
Because
خلاص, we define some question
yeah,
like asking about the baseline status, safety at home, social history, family tree if it is genetic. So we define for each other, like for us as an overseas, some history schemes, which we call it between two brackets allowed history. And we خلاص, decided about some questions. خلاص, let's enumerate rather than asking. And we said those are a forbidden history question.
and this is why what I wanted to add is even though the transcript that is given to the surrogate is being calibrated by the RCP, so they have to do the calibration for both the question and the transcript. But because the exam is being given in a different language, in a different country. But here, if you ask the candidate the question, it will be like if you are asking our patient in our language what thing he can find. If he's a surrogate, he can find a way around the question if he's not fed with that information. But they are afraid that the simulators might be giving an answer that might deviate
change
the
the whole
scenario,
task of the
change the whole.
scenario.
So this
If
is
you
why
said
they are
yes,
against
for
that.
example, I lost weight, so you will be in
Yeah,
front
I
of a
think so.
very yes, like inconvenient answer which you did not expect.
Yeah, I think this is the concept. It will waste the time more and more, and you have just time to give instruction, not to analyze and ask more about the symptoms and other things.
So better
Anyway,
to enumerate and be in the safe side.
exactly, yeah. And the same time you will save your time. The way
Um,
you are taking or asking a question and waiting for answer, really, it will waste some couple of seconds, maybe minutes. For example, if you ask, "Do you have fever?" Yes,
what
doctor, I have. How
to
much
be honest,
it was?
why
Yeah.
yeah, why I asked this question, Dr. Bassem, is that I feel that I'm finishing everything, but there is still a time. So I wanted,
No,
okay,
but you didn't talk about a complication. The anemia itself, one of the very serious complication.
Malabsorption,
I
yes.
Yeah,
think
malabsorption.
In general, the whole thing, the
I
muscles,
so
yes, the
I think
like
Dr. Basim,
I
Dr. Omar, he
spoke about,
asked, but I think this is clinical communication. So you have the diagnosis clear. In the history or in the LCC, we will ask because we want to reach something. But here, the patient needs to know what is going on. And this is the disease in front of you. There is a clear
Mhm.
diagnosis. So you are the one who will give the information about the in this scenario disease scenario. You will give the disease in definition in simple way, the symptoms, and you will take the sentence written in the scenario and the task if they mention something like that. So you will give even the complications, even the association. As Dr. Omar he asked, he says there is another autoimmune. Yes, there is, but you will give as information. This disease can be associated with other disease like this, like this. If you want to mention, you will not mention do you have, for example, thyroid or diabetes? No, you will give just like information. You will not ask as a
Mm.
symptoms as you ask. Did you get my point?
Yeah, thank you,
Yeah, yeah,
Dr.
yeah,
Mahmoud.
yeah, yeah,
Really,
yeah, yeah, yeah.
you
I,
said
I,
it clearly. I
yeah,
like I like your
and then you will give it this information simple,
exactly.
then just simple, and then you will check the understanding. Did you check? Did you understand what I
Yes.
said? Is that okay? Do you want me to repeat? Do you want something? And then you can say what the Dr. Hind said. Even in the red flags, you can mention also other information. You will not ask if you feel or if you feel something like this red flag, what you will do,
So,
and then you will
Mhm.
conclude with the conclusion.
So what I offered is the main safety netting that I gave. I don't know if you agree with me. Is if the symptom didn't improve with stopping the gluten. I think this was for
is
this
a very
stage.
important red flags.
For
Yes, I
this
missed it.
stage, yeah, for
Yeah,
this
if no
stage,
response, I agree with you.
for this stage, because will be a follow-up visits where we can build up. So this is why I chose to start. If the symptom is not improving with stopping the gluten, then there's something is wrong. Or maybe there is a lymphoma station. But I didn't want to
No, you will
worry
not
her
mention
from
the
the first.
possibility. You
Yeah.
will just tell her that if the symptoms did not get better, come to us. If the symptoms nature change, or if any new symptom arise. So these are three which are considered red flag. New onset symptom, if there is a change in the nature, like there is a headache, it's medication overuse headache because the nature
Mhm.
is certain nature, certain severity, certain frequency. So if this nature change, it's not anymore medication overuse headache. So if a new symptom arise, if your symptoms nature changed, or if no response to treatment, this is a very nice addition for the red
Perfect.
flags. Please
Yeah.
approach us, and you can enumerate few examples under each category. But mainly the red flags are about these three: nature, change in the nature, appearance of a new symptoms, or if no response to treatment. And we prefer always to keep those not when we are introducing the disease. Like in the beginning, you are defining, giving the symptoms, the signs, the complication, the prognosis. So at that stage, it's very early to discuss the red flags because even the complications, sometimes they tell you that you are giving hard time to the patient. So, but still, we have to discuss, as Dr. Bassem said, the malabsorption. And if you didn't comply with the treatment, the malabsorption symptom will worse. But the red flags, we prefer to keep them at the end. Like, we will keep you under follow up. Please, if you had any of blah, 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 come come to us
Yeah,
again.
I tried, to be honest, to find out if there is any hidden concern or anything by asking her, is the gluten-free diet is accessible to you? Is
This
the
was a very good question.
so
This was a
what? Uh,
this was a very good
but
question.
there was no, so I started. Okay, what we need to fill the time by something.
What did you ask? I'm really sorry, I didn't
No,
get your
Yeah,
question.
no.
you
So
have a
what
lot of
when I
time to ask
asked,
about complication, to mention the complication.
Oh,
Dr.
okay.
Hind, he's saying what else we can discuss?
no, like what is the usual concerns in this scenario in other
Yes, I will
systems?
tell you. Actually, they were not asked by Dr. Selma. She will ask you, Doctor, I cannot give up on the pizza. Rather than eating a full plate of pizza or like 8 pieces, I might
Mhm.
take 2 bites. Is it okay? One spoon of pasta. So what you will tell her? So I
If
will not get the
gluten-free
symptoms.
pasta, gluten-free pasta and gluten-free pizza is there. If it's unavailable, then it's a different situation. But
See, there is a
here,
misconcept. First correct the misconcept. The
yeah.
misconcept is taking small amounts will not produce symptoms. So first correct the misconcept. You should tell
Mm,
her, I'm really sorry to tell you that even a very small bites, which you cannot imagine how much it can be small, it might
hmm
make symptoms come back again, and it will disturb the whole control which we were trying to achieve over month. Okay, she
mm,
now will step back. So even a small amount, then suggest the solution. So
Okay.
I suggest you, if you felt you want to eat any item like pizza, pasta, now since the food industry has improved too much, so there are a very tasty, good alternatives which are gluten free and at the same time give you the same experience as the regular pasta and regular pizza. And we
And
will offer you this help through our dietitian. He will sit with you, he will guide you to the sources, and he will
mhm,
guide you he will teach you how to read
mhm.
how to read the grade ingredients, what you have to check, what you should avoid. So the dietitian here is also very important in the management plan because he's the one who will do all those steps. Okay?
Yeah,
Mhm.
perfect.
So
Thank you, Dr.
first
Hind.
Yeah, yeah.
correct the misconcept. Never
Exactly.
ever try with the solution because the patient, after you will give the solution, she will eat 1 bite of pasta because you didn't correct her misconcept. Okay, what about taking a 1 bite? Why he's making my life difficult?
And to predict the next scenarios or the next upcoming scenarios, it will be like the hidden concern will be, okay, she can't give up on, or she has tried already the gluten-free diet and she didn't find it tasty, or she don't want to. She enjoys eating. This is, I'm predicting what
Yeah,
they
yeah,
can
Something which can
do.
come.
yeah, yeah, of course,
Agree with
yes.
you, and that has come in IPD. That you are telling the patient some dietary advices and you will come angry, tell you, doctor, your medication didn't work, your CPT didn't work, and your dietary modification didn't work. And the whole idea was about the social, that she have a difficult, stressful life
Yes.
at job, and she's a
Mhm.
smoker, and she's alcoholic, and I think what else? And she has, yes, a very bad, let's say, marriage life.
Can I?
She has two children. Anyway, the idea was not in the whole treatment. She received CBT. She's following the dietary advices, and the whole thing is which making her stress
Stress, a
is
hidden stress.
stress. Yes, hidden stress in her. Not only a job, in job, social life, smoker, and alcoholic. So you will again introduce for her some extra escalation in the treatment plan, like rather than just applying CPT, there can be some additional relaxing techniques, goal achieving sessions. I don't know those terms, you can use them, and we can try those, which is an extra modality of treatment, and we can reintroduce some stress relief
No, we can.
methods
No, no, no.
and help you. And
Occupational therapist.
occupation. No,
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 no.
no.
So
I'm
first
talking
thing, yeah.
about the management will not stop at the CPT because she don't
Oh,
know
yeah.
that how many steps
Yeah.
we can escalate. So we will escalate the treatment, even sometimes the medication. We can escalate the
To
medication,
control
but
the
we will
symptom.
control, yes, but we will take care of your social life. Okay?
Yeah.
Because also she was talking to you as if things stopped here. If the
Yeah.
CPT is not working, if the dietitian is not working, we are done. No, you have to reassure her that we can escalate the treatment, but also we'll take care of your social life, of your occupational life, and you have to make some changes in your lifestyle. So whatever you are expecting as a concern have come in another disease. So I agree with you that she can tell you it's not tasty, but let's try to address the concern. If it came like this, either you or Dr. Salma, anyone can try to address it.
Yeah, so the other thing is that if it's an established diagnosis and this is a follow-up visit for established diagnosis, symptoms
Agree.
are not improving, let's forget about the disease. Usually why the symptoms are not is not improving. What is the risk factor that the patient does have? Does she have any hidden risk factors that needs exploring? This is the idea from the upgraded discussion that we are having.
Yeah, but don't forget to ask about the idea about the disease itself. She
Uh,
might
yeah,
not
yeah.
know all the details, so
Have
you
you
can,
have you been
yes,
have everyone
updated.
explained? No,
Yeah,
has anyone explained to you what you are having? So it might be the
exactly.
idea in explanation. No one has
Education,
explained. Yeah.
educating the patient very well. But
Yeah,
wait a minute, you forget something very important, which when you gave me the concern, you already gave some examples. If the patient said, I don't feel it is easy for me to comply with the food, please,
Why?
you have to ask, why
Why?
do you
Yeah.
think? She might tell you that it's not tasty. So don't stop here. Ask her, is there anything make it difficult for you to comply with the gluten-free diet other
Yeah.
than the taste of the food? Yes, doctor, it's expensive. This is another concern which has come. Anything else, it's not accessible. Anything else, I go with my friends to the restaurant. How come you want me to tell them I cannot order from the same menu? I will have a social stigma. They will
Uh,
start asking me questions. I will
it,
never be able to go to restaurants and eat freely with my friends. So
yep.
all those concerns will come up as obstacles for her
Yeah.
to comply with your gluten diet. And you have to address each one by itself. And all those concerns has come before.
One thing to correct in our minds all when Dr. Hind mentioned alcoholic. So instead of alcoholic, let's keep in our mind alcohol excess problem.
not
Alcohol
only
excess
that.
problem. Yeah,
Yeah,
alcohol excess problem. Keep it in your mind like this. Alcohol excess problem.
And there
Even
are
if
some
you are
types of
telling,
alcohol which contain gluten
exactly.
no,
This is what I
yeah,
wanted to comment on, Dr.
or
Amr.
alcohol
wheat. I
contains
think
The
gluten.
wheat or
beer,
Yes,
gluten. I
the
forget.
barley,
Barley.
the
especially
beer.
also the Scottish whiskies that does have some starch and some certain
The
starch.
wine
Yeah.
and the whiskey, all of them are free or gluten free. The beer only containing gluten. The beer are containing beer.
The beer, yeah.
Yeah, the beer are the
Uh,
gluten. Yeah, contain. So if you are talking about the alcohol, because I mentioned it, but I didn't explain. So
why?
the
Yeah.
alcohol here, yes, not
Have
only to
two
address
benefits. Mentioning it have
exactly.
two benefits.
Yeah, not
So,
only
but
for alcohol side or the harm of
yeah.
alcohol, even the alcohol type will harm her, particularly the celiac disease. So it
Mhm.
can make a flare up of the disease. Okay.
To be honest,
Yeah.
it wasn't in my mind at all. Yeah.
So I think there will be a lot of items that you need to
Yes.
discuss, and the concerns, to be honest, might be even more variable than whatever concerns has been يعني mentioned in the scenario. Usually even the delay diagnosis can come in celiac. So celiac has a lot of variety of scenarios. Like I have been struggling for a long time and nobody has mentioned this diagnosis. How come now you came up with this? I thought it was IPD. I thought it was lactose intolerance
IBS
or
or
whatever.
GP delayed diagnosis.
Yes. So
Usually
this is a
GP
one
delayed.
variety and it will fill your time with concerns.
Here it's very common thing that GP delayed diagnosis. It's very common scenario here, rather than overseas. I think the
Yeah, that's why
delayed.
it's
Yeah,
also one of the top differential in any disease, in any diarrhea complaint.
And any anemia, any fatigue. Yes, any
Yes.
fatigue, anemia, weight loss, they always like to exclude
They
celiac
like, yes,
or at
exactly.
least screen celiac by doing serology and immunoglobulins.
what I wanted to reiterate is that whenever we are discussing alcohol related thing in the exam, let's not say the patient is alcoholic. even in the
Yeah.
communication. Let's say
I
alcohol
like to ask,
excess
how is your
problem.
alcohol habits?
No. When you are discussing your finding in the exam with the examiner, pay attention not to say alcoholic.
Alcoholic.
Whenever you are discussing the problem, you are summarizing your history, not in the communication station,
Yes.
but
Yes.
say alcohol excess problem. It's like to train yourself on using alcohol excess problem instead of alcoholic.
Yes.
That's
And
stigmatizing.
the
For
term is
smokers,
medical.
he had smoke. He's smoker. Smoker is fine, but alcohol excess problem
Yeah.
is one of the things that
Stigma, they consider it as a stigma to the patient.
because the patient is sitting in the same cubicle with you
Not
and the
only that,
examiner.
it's as a medical term, it's not
Yeah,
there unless you have the symptoms of alcoholism. So it's not only medical, not only as a welfare point, it's also as a
From a
medical.
medical point of view, it don't fit.
Exactly. Yeah.
yeah.
Okay. It's a very, really nice discussion today, Dr. Omar and Dr. Hind. We help.
Dr. Salman,
I
I hope,
made your
yeah,
life difficult. I don't think it was, I
No,
don't
I
think
think
it was good.
Dr. Salma
when
was
is
very kind surrogate. She
yeah,
didn't have
I
all
mean,
this
yeah,
concern. But in the exam, be ready. You will suffer and you might have very tough surrogate. She might shout, she might be
in one of
angry.
two scenarios, you will be having a difficult surrogate, and you are having another surrogate that is he's doing well
Yeah,
with you.
exactly. Yes. Let's start with the comment. I will start with the last one. It's a repeated question. Is it breaking bad news? As I wrote in the definition, any disease that
Disease
can
counts.
affect the quality of life or make you difficult to cope with your daily activity, either by the disease manifestation or the complication, and it will be long-standing disease, I will deal with it as breaking bad news, even though it will be managed or it can be controlled once you change your diet to gluten-free diet. Even the changing to gluten-free diet, something to suffer. It's not easy to have separate diet away from your friends, your colleague. I know one of our colleague in the hospital. Whenever we have any meal or
Party.
any party, he's saying,
You
"I'm
cannot
so sorry. I
participate.
am yes, yeah." What do you think? Is it bad or is it something easy? No, it's not easy. Really, he's suffering, and all of them are suffering. So I think it's breaking bad news, right, Doctor Hind? You want to say another?
See, I would say that whenever you are in front of something, because I agree with you that his lifestyle will change, but as a disease, if he comply to gluten-free diet, he will live a normal life expectancy. So whenever I am in such a situation, I will break the news by saying, we did for you the investigation and we found out something concerning. So is it okay for me to share it with you? Yes, doctor. What is going on? So I will not make it like a drama. So
Yeah. We will not say
yes,
Yeah,
we have a
something.
deal,
Yes,
Doctor.
and or at least we found that you have something affecting your gut. Okay,
Yeah,
but make it as simple as possible, because
yeah.
I think since there is a good treatment and the patient life expectancy will be normal, so I
Yeah.
don't want to break it like if it is cancer and it will shorten the life
No,
expectancy.
no, no. We
And
deal.
simple, yes, simple words, but you
I
have to go
think
through the breaking news. If we didn't
Dr.
say
Hind,
bad,
Okay.
breaking news
Breaking
yeah,
scheme.
news. Yes. Good.
So you
Yeah.
have to break the news. It's not that I will
Perfect.
go into the celiac, I will dive into the celiac
Yeah.
immediately.
Yeah. Yeah.
We did the investigation and we found out you have celiac disease. Have you ever heard? So you
Yeah.
overcome, you bypass all the step of breaking a
Perfect.
news. Okay,
Yes. Yes.
so
So it's
breaking
breaking
bad
news.
news, it needs
Of.
some drama, golden silence. Do you need a tissue? Can I continue? So there will be some, let's say, steps, extra steps when it is bad
Yeah.
news.
So
But
it's
when it is a
breaking.
breaking some news, use the
Yeah.
word concerning. Something abnormal came up in your results. Is it okay for
Hmm.
me to share it with you? Oh
Yeah.
yeah, doctor, what's going on? Something affecting your gut.
Yeah. I.
So
Yeah.
you need
I would like also
steps,
to.
let's say.
Yeah. To say whenever you are explaining or you are saying this breaking news, don't explain before mentioning the name because Dr. Omar said it's autoimmune condition that affect
Called, yes, agreed.
the it's called celiac. No.
So he went into the whole thing before
Yeah.
giving any steps, any intro,
Exactly.
any
Yeah.
signposting. He immediately
Yeah.
explained.
Yeah, so whenever you have a condition called celiac disease, have you ever heard about it? Then the next step, the explanation in this way. Okay, let's go to the other comments before ending the session. And yeah, let's start from down upwards. Dr. Limar, he didn't mention the symptoms clearly and also the complication, lymphoma. It's not common, so but you can say if he asks about it, you can say it.
I didn't
Otherwise,
want to say it, yeah, because
yeah,
it
yeah.
will complicate the scenario
By the
right
way,
now.
it's one of the concern. It's one of the concern in every celiac disease
Is
or
it
other
cancer?
disease. Exactly.
If you're asking me, is it cancer? I would ask
Yeah,
no, but one of the consequences, if you don't follow the
exactly.
gluten through that, it
It
raises
might
the
turn
risk.
to
It
exactly.
it raises the risk of cancer because there is another question. So if I
How do
stop
you feel so far?
I stopped eating gluten, the risk goes back to zero. As the what's called
Minimal. Don't say
uh,
zero. It will be
not zero,
minimal.
back to the
Normal
as-
population level.
the normal population level.
Yes, agree with
It's
Yes.
you.
back
Do you
The
to
have
the
risk
any
of
normal
cancer
population.
will
expectation?
be equal to the normal population based on age, based on race and ethnicity. So it will be back to the normal
Perfect.
population risk.
Two
Yeah.
concerns regarding the cancer in this scenario.
Yes. Dr. Limar offering multidisciplinary team. Yes, of course, you have to mention a group of doctors. Don't say MDT. Whenever you want to say a group of doctors and specialists will follow you, they will take care of you, they will give you appointment, and don't worry about that. You will not be alone in this journey. We will always be there. Okay. The next comment, Dr. Limar, yeah, we mentioned it. Also need to ask about family planning. Perfect point, really, Dr. Ala or Dr. Aisha. Oh, sorry, I cannot read. Alishiba. Okay. Also need to ask about family planning. Celiac can cause subfertility. Perfect. So, and as we say always, any patient in the childbearing age, we have to ask about plan of pregnancy and any medication or birth control pills because this patient already have subfertility. What if she took the OCP? She might lose the chance or the opportunity to have a baby in the future. So you have to be careful not to be taking this unless she has a problem with her pregnancy.
And those one of the history questions which are really allowed and will give you a bonus because if she's a female young, so it will be part of your scheme that any family plannings are you plan. So she will start talking about yes, doctor, or no. At least you will involve the woman doctor. So anything you are deciding for, she will help you to plan and she will give you some advices in case she's on a birth control pills. But anyway, keep it general because sometimes it's not the agenda of the patient. If it is the agenda of the surrogate, he will continue asking on the same point and you will open a door for a hidden concern. But if it is not her agenda and you tell her we will refer you to the woman doctor, she will go to the next step, don't go in details. But it is one of the history questions which we need to ask and it's considered a history. Any family planning? Are you planning to conceive? All those questions are important in a childbearing age lady.
Yeah, perfect. Really, it was very nice comment from
Addition,
Dr.
agree. Yeah.
Alishba. Yes, it was one of the points we missed, but she covered it. Dr. Al Shaima, I give the first scenario to chat GPT and this comment the risk of mitigation without big tube, even without a big. There are things we can do to reduce the risk of aspiration and keep him as comfortable as possible. Speech and language therapist to advise on safer swallowing technique, modified food texture and thickening fluid, eating slowly, upright positioning, and avoiding meals when he is very tired. Good mouth care to reduce the infection risk, early recognition of chest infection. These measures will not remove the risk completely, but they can help reduce it. Perfect. And this is also mentioned by Dr. Hind. So I think it was a really a good discussion when Dr. Hind gave this instruction earlier. Okay, the next Dr. Limar, he didn't ask about how much she know about her condition, expectation, invitation, yes. Dr. Tahani, in long standing, if not controlled, it can cause lymphoma. Perfect. Yes. Okay. No history taking. I think about disease counting. Yes. Okay. We finished the comments. Anyone has a comment before ending the session?
Yes, Dr. Basim, in this case, I think the patient is already, for example, she has diarrhea, and I know, and she already did endoscopy, and I know. Should I say before I will say like what Dr. Omar said, just celiac? Yani I will see, yani for example, how do you feel so far? Because I know this patient, she has tummy pain and diarrhea. Then I can see the camera test will be, do you have any expectation or just I will just see this see the sentence in Breaking Bad News, or it can fit here before I will give the diagnosis.
It's written there, right? It's clear diagnosis as celiac.
No. I mean the sentence
The
before you
the
will.
You mean the
preparation.
introduction?
It's
Do
Okay,
just
we, do
you
we
like
can.
go through the
introduction before you will
Yes,
just
yes.
before you will say celiac يعني I mean you
But
will يعني you will ask the
yeah,
patient about his
I
expectation
I
regarding
got
any
I got it.
endoscopy.
By the way, Dr. Mahjou, I always advise to ask this question as introduction, just to feel to let the patient, the surrogate, feel calm and comfortable to your conversation. How are you? How do you feel today, Mrs. Or Mr. X? Are you okay? Then I'm here to talk, and you can continue your speaking.
and any
Uh,
thoughts running in your mind, because he might have different expectation. He might tell you it's an infection.
Yes. Yeah.
And if you didn't ask what thoughts are running in your mind and you missed the concern of infection, so again, it will be considered against you. Those steps, to be honest, are fixed. But sometimes we miss
yes.
to comment on those fixed points.
Mm,
So I agree
yes.
with you. We didn't we didn't talk about the intro. We just talked about the body and about the closure. But to always keep it in your mind.
Yes.
Permission when there
Yes.
is a next of kin and carer. خلاص, it's a fixed. Checking capacity, asking about what thoughts are running in your mind, check the background, those are really fixed. So if we
Yeah.
didn't remember to mention them, they are not for certain scenarios. The introduction, which contain how do you feel, how do you want me to address you, like how much do you know about your condition, any thoughts running in your mind about what is going on, those are fixed whatsoever the theme of the scenario, and
Yes.
always might came up with or help you to come up with some hidden concerns which will not be asked except if you go through this proper introduction. Okay, and it will also make the examiner happy. Such an intro will make him
Yes.
more interested to follow
Yes.
up with you. But if you start with wallah, we did some investigation, you have an autoimmune disease
No,
like
no.
Yeah.
celiac.
In breaking disease news, like let's call it breaking disease news. You can. I use one of two strategies. Is to give
Mhm.
the patient the offer. But today, to be honest, I was very hungry. I didn't eat anything in the morning, so I wanted to finish very quick. But usually, what I say,
Mm.
hello, Mr. X. How are you doing? Thanks for coming to our clinic
Yeah.
today. And then, so would you
Oh,
prefer us
تعرف إيش امبارح؟
me to start by talking about your symptoms, or I do understand that you are here to discuss the result. He would say yes. Do you want me to break the results to you first, or to touch with how you are coping? He would say whatever you would like. So I go with the normal rapport, or sometimes if he will choose, okay, let's discuss the results. So we've done this test and why we've done it, because you had those symptoms, and this test result has shown
some abnormalities or something.
the
Yeah.
abnormalities.
So any of
We
them,
found that.
yeah, any of
Yeah.
them, according to your approach, what you prefer, but
But you
don't
agree
start.
with us. You agree that
No,
you
no,
need
no.
to
Yeah,
have
I
it.
agree.
خلاص,
I
okay.
agree.
So
I
at
Yeah, yeah,
least
completely agree.
now we agree all of us that whatever the theme of the scenario,
yeah,
we need to go. أنا آسفة دكتور
exactly.
باسم قاطعتك.
No, no, no. This is what I always advise. I always ask, "How are you? How do you feel?" And the expectation, what's in your mind, and so on. What I mean, as Dr. Hind said, don't start rush to the task or the breaking news or even the explanation, whatever. You have to let the patient or the surrogate feel comfortable to this conversation by some introductions.
Yeah.
Okay. Yeah, one question here I should read because about airplane should informed because there is a special portion. I think it's good to mention. You mean a special meal. It's okay, but it's not the time because you are talking about the all diet, not only in the airplane. So he will be
But
aware about this.
yeah, but this is very well if the surrogate tells you that I'm
Yeah,
having
if he
a trip
remember.
no, I'm traveling next week. It will be brought up if they wanted you to. It will be brought up by the surrogate that I'm traveling.
Yeah,
Okay,
yeah. So
yeah.
remember to select the meal which is fit for you.
And
Yeah, and
also,
this way.
whenever something like this raise up, don't confine your answer to the question itself. He should check the ingredient of the food and inform whoever
In
is
every meal.
providing him
Yes.
everywhere, on a
Yes.
plane, in a
Perfect.
restaurant, in his workplace, at home for his family. So you have to take the chance to give a proper advices. Sometimes it's a chance for you to see, are
Yes.
you only confined to the question, yalla, you are going to the plan, tell them in the plane, I'm sorry, in the plane to provide you with the proper meal. Why in the plane only? You have to read the ingredients
Yes.
everywhere. You have to
Exactly.
inform people who are providing you food in any
Yes.
place, whether your family, whether in a restaurant, whether in a plane, in a train. Everyone should take care of you and reassure him that this disease become like the education about this disease and the social, let's say what they call it, social awareness.
Oh yeah.
There is a good social
Yes.
One
awareness about
Yeah,
this
one
there is
disease,
group
one
of
and
thing. No, yeah, this is what I just remembered. Signpost the patient to the group,
to
the relevant group,
societies. Mm.
to the societies, so they can
yeah.
provide some steps
How to integrate themselves
how
in the
to
society.
how to use things. So it depends on the disease that we are discussing. For example, celiac, they will introduce you to where to find
Proper food
the proper food. What
sources.
is the best restaurants? What is that like that? Do you know what I mean? Practical thing that they know
Yes. Yes.
from their experience that we don't know because we don't have the disease. There are some certain disease that it's very important to mention that the signpost to the group to the
Like
community.
MS,
Yes.
MND.
Yeah,
As
MS.
Yes,
asthma
MS is
and
very
motor
important.
neuron. Yeah.
Celiac, IPD. So
Yeah.
because those patients have long-term suffering, and
Yes.
sharing their experience and listening to
Yes.
the experience of others will help them to integrate themselves in the society in a way which is like appear near normal. So they will give them
Yeah.
very good
Celiac UK,
advices.
I think this is the
This is
society
very
that
important to be honest, and we usually forget it. But for I think, as you said, in UK, because they have a very well organized societies, so
Yes.
mentioning it will even if you are overseas and one of your examiners are UK examiner, he will be very happy to hear this, and it will give you a
Dr.
bonus
Hind, it's not
points.
only UK, by the way. The secular patients in our city or our
In
not
our
yeah
societies, the common
yes.
disease, they have societies also.
I
Yes, I
surprised
agree.
when they are having contact together in a
Numbers.
group, WhatsApp group, not in
yeah.
only one hospital, in all Mecca hospital, for example. So it's not
Ah, okay. And
single.
there is well established between the
Yes,
patient themselves. Mm.
themselves. Yeah, so
And they
it's
give
good.
cooking advice, some
Yes,
best
sharing the experience. It's
yeah,
very good.
so
Menus sometimes.
yeah.
Yes, I agree. And I think this is a very important thing to discuss, and it will consume your
Yeah, it
time.
will.
The societies, the advices, the places, we will be
Yeah,
with you, and the dietitian will help. So all those things will make the patient reassured, and he might really change his mind from being competing your plan to like to accept and feel like, okay, it's applicable. I can try.
yeah. By the way, I said sickler, not celiac. Sickler.
Yeah.
For us in
Yeah, sickle,
KSA, sickle and
sickle,
thalassemia, I
sickle
agree if
cell.
you told
Yeah,
me there is
yeah.
Sickle
established
cell.
societies,
Yeah, they are. They are. Okay.
because this is very common. Mm.
Yeah, they are, and they know how to manage and to deal with the life. Yes. The last comment from Dr. Mahjoub. Thank you for the amazing discussion tonight. Yes, I agree, and I would like to thank you, Dr. Mahjoub, when you said about the communication
Yeah.
scenario. It's a station to give information, not to gain information. It was really nice comment, and I forget to thank you about this. So the communication scenario is the station to give the information because you have the diagnosis, but in the long clinical, it's the station to gain or to gather the information from the patient so you can ask anything. Again, the comments, the all chat discussion will be available in the Facebook group in the comments. Anyone want to see, because I have a lot of messages today and it's informative. All of them are informative. You can follow up the Facebook post, then in the comment, you will find all the discussion as a screenshot.
Wallahi,
And
thank you, Dr.
And
Bassem.
special, yeah, special thank
You
you.
are
Yeah.
putting the pictures in the videos, which was like, I need to learn this from you. I don't know how you do it. Like the pictures in the videos, and you share the comments. والله العظيم الله يسلم إيديك.
yeah,
ويكتب
it's,
أجرك ويكتب أجرك يا رب دنيا
I
وآخرة.
mean,
Yeah,
I mean, Ajmal.
and especially, yeah, Dr. Basim, you've tolerated all of this for
It's
so
okay.
many time. Yeah,
It's okay. For the sake
yeah,
of all
We need to
learning.
yeah.
Yes.
especially thank him for tolerating me since long time.
Yeah.
I know that the comment will be valuable, Dr. Hind. That's why I always
الله يسعدك
appreciate
يا
your
رب.
comment. The last thing I want to add, even the skill marking, I tried to also to put it in the comment. The participant who want to see how much and what the skill he or she want to improve, she can see in the comments the according to the first case skill marking or the second case skill marking. Everyone, I mean the participant can see the skill
And
marking.
just one advice, guys, if you
Yeah.
want to learn what is the meaning of each skill and what you have to like keep in your
Yeah.
mind to score your friend, read the RCP scenarios. There is around
Yes.
like a 24. It teach me myself. I used to
Mhm.
ignore some points and not to keep it as a part of my either assessment if I'm giving the scenario to someone
Yeah.
or for myself when I'm doing anything or
Yes.
studying
Yeah.
it. When you will read the RCP scenarios, 24 scenarios, and read it, not like, do you know when you are reading or like just like not try to
Journal
understand
reading.
what is between the lines, why this transcript is given to the surrogate. It mean I should, as a candidate, ask because they gave the answer to the candidate. If the answer is given to the candidate, it mean that I
This
am
is the
as
calibration.
yes, given to the surrogate. I'm sorry, if this
Yeah.
transcript given to the surrogate that my wife has died and I'm taking care of two children. So me as a candidate, I must have asked a question about how is your home circumstances for this answer
Perfect.
to be
Yes.
brought up by the surrogate. So
Yes.
reading the transcript, it's not like
Mhm.
reading a story. You have to
Yes.
understand that you need to ask about points which was given to the surrogate, not haphazardly. It was given
Mhm.
because you are expected to discuss those in 10
Mhm.
minutes. And don't
Yes.
forget that those scenarios are calibrated for 14 minutes. It's not a big problem. They will cut some concerns, but please, it will open your, it will, yeah, it will give you a good prospect, a good understandings. You will be able to anticipate by reading those RCP scenarios. So read them, and you will be able to assess your friend, and you will able to do a good calibration for yourself whenever you attend any scenario. Okay, what was discussed in this scenario? Clinical judgment should include these points. Communication should include, because sometimes the big mistake we do is that, okay, what I should say in the clinical judgment, what is the difference between the points which should be discussed in the clinical judgment and the points which should be discussed in the clinical communication? Okay, so try to read those RCP scenarios and you will
Mhm.
understand a lot of points. And don't read them once. Wallahi, each time I read them, I come up with different ideas about
Yeah.
the calibration which is mentioned there. And every time I realize a new points. It's
Yes.
very nice group of scenarios which is given as a gift for us from the RCP. And if you, Dr. Omar, are in UK, because I noticed that you people in your mock, they gave you like they gave the surrogate something similar to RCP scenarios, a transcript with calibrations. Because
Yeah,
one
so this
mock,
is called
like
the
2 3
calibration, yeah.
days mock, was conducted here in Jeddah, and I noticed, mashallah, they came with a wonderful like group of scenarios, but they were very keen to keep them, not to like distribute them. But anyway, these things, if like for you in UK easy to be accessed, يعني accessible,
Yes.
I
I hope
will, I
so.
will,
wallahi.
I will share, but unfortunately, no, it's a business. So everything related with
Yeah.
PACE's
This
exam
is
is
the
a
problem.
business everywhere.
Mhm.
See, do business
Unfortunately,
with
I
us
wasn't.
and we
No, no,
agree to
no,
get
no,
the
no.
scenario.
I didn't. No, no. I'm not saying that
No,
because
no, not for him.
unfortunately,
Not for
unf
him. For the one selling them. Yeah.
yeah. So unfortunately, I wasn't. I will not be able to go to any courses before my
It's
exam
okay.
because
No,
it
no, no,
was
I agree
all
with
of them
you.
are is pre-booked two
Mm.
or 3 months
Okay.
ago.
Let's, Dr. Hind, we can ask you where exactly because Dr. Mahjoub and
It's
Dr.
on the
Limar are asking.
I'm
In
trying to
RCB
open
website.
the
Yeah.
Paces, yeah, website. Just one
Yes.
second. Website.
You can share it to the group. Yeah.
The website where you people book for your exam, mrcpuk.com,
Yeah,
Faces.
and
there
Yeah.
is
write cases
sample
samples.
scenarios. Sample
But
scenarios. Just one
unfortunately, guys,
second.
the old scenarios have been removed from the website. So there is a PDF where nice doctor, his
Do you
name is
have it?
Sarwar. Dr. Sarwar, he collected them, the old one, when the previous theme of PACES was was يعني when it was 14 minutes. So if I find that PDF, it is a very nice PDF, contain all
You
the
know,
old samples
it's on the
plus the new
Telegram group.
samples.
It's Telegram
It
group,
is
our
there.
Telegram group.
خلاص, just reply or like do
Okay.
for them whatever
Yeah.
a way to
Okay.
access
Dr.
it.
Omar also share the website. This is the website, Dr. Limar and Dr. Mahjoub and everyone. You can read it in the chat box, the last one. Anyway, we can share it again in the WhatsApp group. I will share it right now.
Dr. Hind, when is your exam?
يا دكتور عمر, you asked the most difficult
Okay.
question.
Okay.
You are the most difficult
No
question.
worries.
I already applied for Diet 1, but they canceled Diet 1 in Jeddah, even though they
Okay.
did the mock. Now they are planning to do it in Diet 2. So I'm thinking to do it, to apply again. And I will choose one
Inshallah.
center, Jeddah, and I will choose another centers. Let's see, like Qatar, Oman. I will
Are
try.
you sure, Dr. Hind, they cancel it? Because I just hear it's just approved last month. They cancel it?
And see, it is approved, but they didn't approve it early enough to
Okay.
open Diet
To
1.
put it in the in the
Yes, to put
website.
it in the website and for people to start
Okay.
like applying. So they
Yeah.
said we are very
Maybe
like,
next diet.
late for Diet 1, even though they was planning to conduct Diet 1. But at least I don't know. Do you know when and sometimes it's also center factor. The
Maybe,
RCP
yes,
college
yes.
is willing, but the center is like need some
Still not,
preparation.
not yet.
So they
Okay.
felt like خلاص, we did a mock, we consume cases, so give us a chance for Diet 2. So it was postponed to Diet
It's
2.
okay. Hopefully soon, inshallah, all
So
of you.
inshallah, Dr.
Yeah.
Omar, but please, if you knew any business, I'm ready really to participate and get the
Oh,
scenarios, because
no.
mashallah, they are doing a very good scenarios, which is like RCP, and it's running in the centers. يعني they are preparing very
Yeah,
nice
yeah.
schemes.
It's only one good course here. It's called Pass Paces, but it's 1,600 pound. No
And
one
they give
would
you
pay
the
this.
scenario, they hand it over for you, or you just like attend the
No,
course.
no, you will attend only. You are
So
not allowed with any material. So I
Yes.
didn't. It's fully booked for this month, for January before my exam. Although that's very expensive, but they do it in the way. But to be honest, it's business between everybody that regulates this exam.
this exam.
But I think you will find the same case because I have one of my friend. He did that one in UK. He did that one of these courses.
Yes, because
What
but
what he
in the
said
UK it's
what
between.
he said he found maybe the same cases in the exam.
It will be, but it is the TART is here is shared between three colleges. So the RCP of London, of Edinburgh and Glasgow. So there are three colleges. They have their own favorite theme of you can give the exam with one of three colleges, but every college does have a theme of what's
Calibration, something
unique
they
to
are
it.
requiring.
RCP of London, they do have some sort of a little bit of things that they are meticulous about, and they are saying, yeah, they are above every other like they are all the same, but you know what's inside the people's heart, that we are RCP of London, that we have the best standards, and so they are trying to make the calibrations a little bit more difficult than the
Order.
others. But although that's been, yeah, saying that Smith with every college the exam is easier, but it's um, there are some candidates who give the exam 3 or 4 times with RCP of London, and then once they changed to Edinburgh, they passed. So
It happened. Do you know, actually, it's not intentional, but it can happen. Like as
I
Dr.
know.
Mahjoub said, the cases will be repeated. Okay, the cases
It's all
was
repeated
repeated
within UK.
unintentionally. Do you know they do their best effort to bring new cases, but also the patient who you plan to bring, he apologized. So you'll bring from your spare. Your spare has appeared in the course. So the candidate will go, he will be happy, he saw the same. He will distribute a false reputation that the patients are repeated, even though it was like, let's say, an accident. The original patient who was planned to come, he apologized, so they brought from the spare. It depends, I think, really, even the examiners. So once, even in the mock, the examiner like went to pray, he didn't come. So the coordinator of the exam, he was in the exam. He was more simpler. So people who went in that cycle, they were happy. And people who
Yeah,
went when that doctor was there, who was more
I
meticulous, I
know.
know about his skill,
Yeah.
even though the same patient. But see what happened? The coordinator came in to conduct the exam instead of the examiner who went to pray. So, do you know, I think it's an accident. It's all, but nothing is intentional.
subjective.
Nobody is intending to make things hard. Nobody is intending to repeat cases, but it's your luck to get an easy examiner to get a repeated case.
Yeah.
But is it intentional? Is it the rule? No, it's not the rule. It's not intentional. This is what I think, يعني, from the experience, from people what they are saying, and from the mock which I really attend, يعني. So I think it's something unintentional.
Yeah.
Okay, thank you again, everyone. Thank you, Dr. Hind and Dr. Omar and Selma. Omar and Selma, but it's occasionally.
Yeah.
But whenever I am writing the name, I remember the movie, Omar and Selma. Okay, thank you again. Wish you a nice and happy weekend. See you inshallah on the
Thank you so
Saturday.
much for this nice
Yeah,
sessions.
it
Like
was-
everything
thank
was
you.
like discussed
Yes,
nice.
it's amazing session, really, wallahi. Thank you, Dr. Hind. Thank you, everyone.
Take care.
Thank you, Dr. Basim, for
Uh,
tolerating us. Thank you.
No problem. It's okay. Thank you too. Okay, goodbye.